Hi guys, how you going? I'm here today talking to Kate Perkins, the beautiful Kate Perkins. Kate's the owner of Cancer Rehabilitation and Lymphatic Solutions and the founder of Bounce Back from Breast Cancer program. So I'm really excited to introduce Kate. Firstly, I'd like to acknowledge the traditional owners of the land that we're meeting here on today and pay my respects to the elders past, present and emerging. So welcome, Kate.
Thanks, Twynette.
Thank you for joining us.
Thank you very much for having me.
Pleasure. What an exciting organisation that you've started, which is really great. So first of all, I just wanted to ask you, what do you do as a cancer rehabilitation and lymphedema therapist?
So many things.
So many things.
So many things. So as a cancer rehab occupational therapist and lymphedema therapist, it's my role to understand the side effects of cancer diagnosis and related treatments. And so that includes knowing or understanding that people can experience extreme fatigue following or during their treatment. They can be deconditioned because of fear of movement through their treatment or fear of exercise.
It's understandable, isn't it?
Yeah, definitely.
Very understandable. Yeah.
And also related, post-surgical treatments as well.
Sure.
And restricted range of movement and the inability to be able to do the things that they love or just normal day-to-day roles. And also understanding the side effects of chemotherapy and, joint pain, sometimes even depression,
yes,
as well, and other side effects like cancer-related lymphedema. So in understanding all of that, I'm able to help guide people through their treatments and after their treatments to get them back to doing the things that they love doing, or get them back to work, or get them back to doing just normal roles in their household.
Because cancer's a daunting process anyhow, so I'm sure the movement helps with the brain as well, your mind.
Well, it is, and so I am lucky that, I'm fortunate, and the people that I see at diagnosis are fortunate to get that extra level of support for a start. And certainly if I get people at diagnosis before they start neoadjuvant chemo, so that's chemotherapy before surgery or radiation, then I get in and exercise with them. It's a very tailored program that I work with depending on their level of fatigue and their functional capacity, but also it helps prepare those people for surgery and radiation and be mentally prepared as well.
Great.
So yes, it does cover a lot. And so a lot of that involves exercise rehab.
Sure.
And which is also a risk minimisation strategy for minimising the risk of developing cancer-related lymphedema.
Excellent, excellent. So you've kind of have you explained what a cancer rehab specialist does? Is that what you would say the crux of it is?
Yeah, pretty much.
Yeah, sure. And so this program you've got Bounce Back.
Bounce Back from Breast Cancer?
Yeah. How did it come about?
So I see a lot of, the majority of my caseload are breast cancer related patients.
Do you see patients that aren't breast cancer?
Yes.
Yes, okay.
Yeah, definitely.
Great.
But the majority of people that come through here are breast cancer related. So I've kind of honed in and specialised in that area.
Sure.
And certainly I'm very passionate about the early monitoring for breast cancer related lymphedema. So we have an early prospective monitoring program in place here, and that means seeing women at diagnosis to get a healthy baseline of an at-risk limb or limbs to monitor for lymphedema. So in saying that, I also see women at neoadjuvant chemo stage. So again, I'm exercising with them right through their treatment, educating them about fatigue management and pacing themselves. Because I have women come through, they've been in the middle of chemo and they're dragging themselves through the door and they're actually not sure if I can do this today. And we start off with breathing, and that's where it starts.
It's a simple thing, isn't it?
Yeah. And do some breathing exercises, and automatically that increases the oxygen to the brain. It settles the mind. They start feeling better, and then we move into some stretching and mobilisation. So I see a lot of women. You know, I'm pretty booked out.
Yeah.
And so it was my aim to want to reach as many women as I possibly could. So that means, well, that's why I developed the Bounce Back from Breast Cancer program. So I could reach, it's an online program, it's accessed online. And so that, you know, extends the reach, not just locally, but Australia-wide. And around the world.
Because it is a problem in our communities having access to good healthcare, and the cost is an issue, particularly in the lymphedema space. I know that it's an expensive exercise, and a program like this that people can log on to online and be anywhere is fantastic. I think it's a great
thank you
program. Yeah. So what can people expect to get out of the foundation program?
The foundation program is a 24 exercise program. It's detailed video exercises. So I'm explaining how to do things. It's like you being in the clinic with me. And it's broken down to 3 stages. So it starts from the very basics. And the reason why I called it the foundation program is because I'm taking people back to basics and, you know, correct movement patterns, and we talk about breathing and facilitating movement and posture and which muscles to be engaging in that'll be most beneficial. And so stage 1, I think that's about 8 videos in there, and which can be started post-surgery within the guidelines. But then there's stage 2, which is more core and stability. Again, you know, I'm explaining, I think there's 6 videos in that one, and then another 8 in the strengthening and resistance program. And also included in that is an exercise manual, pictorial manual there with all the explanations when people get sick of hearing my voice. But also it is, so that program is $147, which is less than an initial consultation with me, and it's lifetime unlimited access. So you can go and log in to the main, there's a login members area on the main Bounce Back from Breast Cancer page. So they log in there, that's where they access the foundation program, and I also have an app as well. So people can do it on their phones or on their tablets, and you know, if they're away from their normal computers, they can still have me in their pocket. And I know. So if they forget how to do something or they're unsure, they just log in and they can go back and take a look.
Yeah, great. So step by step, the online membership, how does it work? So you click on and you join?
So the foundation program is separate. That's a separate program. So then there's the online community membership as well. So the first step basically is I want people to do the foundation program so they know what I'm talking about, and they become, when they're able to do the exercises, it's safe and it reduces the risk of injury as well, and it builds their confidence.
Great.
So then in the online community membership, there is so much more. Excellent. So that is $47 a month. And so again, they log in to their members portal area, and they get access to the closed Facebook group, which is Babe Town for the Bounce Back Babes.
Yes, we love it. We love it.
And so that's a platform for support and connecting with other women with shared experience through their cancer experience, breast cancer experience, but also we do live exercise sessions.
Like we did the other day with Cancer Council New South Wales.
Yeah, exactly.
Great.
So we do 2 to 3 live exercise sessions per week.
Excellent.
So I mix it up a bit. Sometimes I go back to basics, and other times, depending, it's also catering for a whole range of fitness levels and capacity as well.
Excellent.
Because there's women who go into breast cancer treatment who have been really fit. We're talking about young women as well. And so their levels of fitness post breast cancer can be a bit higher.
That's right.
Than others. So I do cater for all levels. And then Kath, she does a stretch class as well. She does a Friday stretch class, and we'll throw in a couple more classes in that also. But other than Babetown, you can log in. There's Move With Me Back to Basics. So taking movement back to basics, and if you're unsure of things, you can log in there and do an easy workout. And then there's Move With Me Next Level, which is a whole bunch of, I just keep adding workouts. And so that's a little bit more advanced. And then there's an education portal. So I just keep adding. So there's new research, new techniques.
Lots of information.
Lots of information. And then there's my Talking with the Expert series. And so I've interviewed Professor John Boyages, who is a wealth of knowledge, and we had to break out that into that session into 2 parts because we talked about a lot. And then we have a dietitian and microbiologist talking about gut health during cancer treatment, gut health after cancer treatment. So there's a huge range of education in there as well, and I don't think I've missed anything. But
I think you've really gone through everything. I've been fortunate enough to be given a bit of a look around the site, which is really exciting, and there is so much information and classes, and you'll be overwhelmed, I promise you. So as a rehab specialist, what are the benefits that you think people will achieve by being a part of this program?
So much. So even for the online community, there's that sense of connection as well. So especially for women who are remote, or even more recently in this COVID environment too.
It's a tricky time.
People have been isolated. So this program has enabled people to keep moving in isolation. And increased energy levels, increased strength and stability, reducing the adverse effects of medications and cancer treatments. And there's the education on fatigue management, so they benefit from the tools of understanding and education around how to pace themselves. There's a lot of benefits.
I think one of the biggest benefits is that connection to other people who are in the same situation. It's a really tricky time, and to connect with people that are going through the same thing you're going through is very important.
Absolutely.
For your mental well-being, as well as all the physical stuff.
And so even you're talking about your mental well-being, exercise itself, you've got those endorphins going. And so you start to feel better. And the world doesn't look so dark, when you're going through those times. But there's times in through the online community, we'll do a Zoom catch up, a Zoom exercise. So after the exercise session, everyone that's on, grab a cuppa.
Great.
Let's have a chat. So there's that. As well. So yes, that connection for your mental well-being and sense of belonging.
That's right.
Because your friends and family may not understand exactly what you're going through, and so you're able to connect remotely with other people, which is absolutely amazing.
That's amazing.
So yes, I'm very proud of what I've able to bring to people.
Excellent. Yeah. Well, thank you, Kate, for having a chat to us today. We'll share some links and some information as well as this video to help you connect with the Bounce Back from Breast Cancer program that Kate's running. So thanks so much, Kate, for talking to Cancer Council New South Wales. It's been great.
Thank you.
No worries.